Hi, everyone. I'm Danielle McGeary. For those of you who don't know me, I'm the Vice President of Healthcare Technology Management with AAMI. And I also have my partner here, Maria Palomino. She is the Director of Certifications at AAMI. So if you call the help desk or send an email, you'll mostly be working with Maria. And I'm always here to assist as well. So before we get started, since it's a smaller group, we can definitely take questions as we go if there's anything you want to ask. How many of you are certified that are in here? And are the rest of you thinking about becoming certified? Okay, perfect. So I will go through both parts then about why certification can benefit you, the enrollment process, and then also the renewal process. So we'll just go through it all. But if people have questions as we go, I'm happy to answer them. Yeah. You want to enable external content because I have a video in there. There you go. Perfect. So before we start, I'm going to talk a little bit about AAMI. I think it's really good just for everyone to understand what we do and along with what we don't do. So our main focus at AAMI is supporting the whole ecosystem of medical devices, from concept to creation to manufacturing, research and development, sterilization, and servicing of medical equipment. So our focus is the advancement of safe and effective technology. We touch about 60,000 folks annually through all of our education programs, certification, our conference, and we have over 11,000 members. And there's a lot of folks that may not be a member of AAMI, but do have contact with us. They may take a course, they may just be certified and not be a member. And again, all of our stuff's available to everyone. So we are a standards developing organization. We are not a trade organization, and we are not like an advocacy organization or solely an HTM organization. So what does that mean? So we are accredited by ANSI, which is the American National Standards Institute, and it's a rigorous process for that accreditation. And in order to keep it, we have to follow a lot of rules like neutrality. So what we do, we develop consensus-based documents around health technology to make equipment safer. And that's everything along the entire ecosystem. So, and because of that, AAMI involves the manufacturers, regulatory agencies, HTM professionals, clinicians, and we are neutral. So, like, we don't do any advocacy or like things like right to repair, credentialing. We don't advocate for law or legislation. And that's because of our ANSI accreditation and because we're a standards developing organization. We develop consensus-based documents, and they would not be consensus-based if they only represent part of that ecosystem. And because of our neutrality, we get regulators like CMS and the FDA to participate in our standards development, and it's really worked in our favor. So like we said, the whole medical device life cycle. So we have 3 verticals within AAMI that many people probably don't realize. I oversee the healthcare technology management vertical, or HTM vertical. So you probably see me the most and are probably the most familiar with me. But I do have 2 counterparts at AAMI that we have a VP over the industry and a VP over sterilization, and we also represent those verticals as well. And like I said, in order to develop standards, it is a rigorous process that we must follow. So we work with the FDA, CMS, in collaborative groups. And what we do is we create standards. So you write a draft, it goes out for public comment. There's committees that revise them. So there's a long, rigorous process in order to develop standards. And probably the most common standard many of you have heard of is NFPA 99. but we have tons of standards at AAMI. But the reason why NFPA 99 is so popular is because it got adopted into law. And that's what we want with everything. So it's really important that if you really want to make a difference in the community, I really encourage you to get involved in standards development at AAMI. You can join a committee. We have equipment committees. We have HTM committees. We just released an AEM standard. We have a medical equipment management plan standard, medical equipment vocabulary. So there's a lot of standards that we write with multidisciplinary groups that, again, are consensus-based, go out for public comment. And that's really what we do. And there's really the three parts, right? So we create standards, then we provide education, and then adoption. And that's where the certification piece comes in, is setting those baseline standards and then creating our certification programs. So why should you become certified if you're not? It definitely shows employers that you meet a minimum knowledge competency and experience experience. It shows that you have skills, because in order to maintain your certification, you have to have continuing education, and it keeps you current. It also helps with advancement as well. It shows that you've worked a minimum number of years in the field, and also it shows that you took the initiative to advance your career and have a credential. So we have 4 different certifications. So we have more. We have sterilization certifications as well, but I'm not going to talk about those today. But just know we have them too. And if you're interested, we're happy to take questions about those after. So we have 4 different certifications within the HTM sphere. We have the CAB-T, which is the Certified Associate in Biomedical Technology, the CBET, which I'm sure most of you have heard of, the Certified Biomedical Equipment Technician. We have the CRES, which is the Certified Radiology Equipment Specialist, and our Certified Healthcare Technology Manager, or our CHTM. And I do have my CHTM as well. I did work in the field prior to being in this role. I actually worked with Mark at Hartford Hospital long ago when I was an intern. But I've done my whole career in the Northeast, started my career in Connecticut, worked for the VA up in Boston, did a short stint at Aramark, and now I'm here. So I have walked in your shoes as well. So the CAB-T is our entry-level certification here at AAMI. So the reason why we created this is obviously there is a workforce deficit of people. 65% of our field is over the age of 60. And we don't have the same number of people coming into the field that we have retiring and leaving. We're down to less than 62-year academic programs across the country. There is only one left in New England. That doesn't include the UConn graduate program, but for 2-year biomedical technology programs, there's only one left in New England. 60. So, and there's 27 states that do not have a program at all. So we've done a few different things at AAMI to try to combat that. We have a BMed apprenticeship. And we also created this Certified Associate in Biomedical Technology certification. So in order to get your CBET, you either need 4 years of work experience if you don't have a degree, or a degree in 2 years of work experience. So there's a time when folks are in the field where they're not eligible to have their CBET. This certification has no minimum requirements. You can be thinking about getting into HTM, you can be graduating high school, you can be an apprentice, you could just be a career changer too, and you can take this and show you meet a minimum knowledge competency. There's no minimum requirement to take it. It lasts five years, and unlike our other certifications, it's not renewable. And that's because after 5 years, if you assuming you've worked in the field, you're eligible for your CBET. So we're kind of bridging that gap. And in this way, now everyone can hold a certification the minute they decide to enter the field. So it is 100 questions, and you get 2 hours to take it. The difference with this certification, besides the rest of them, all of our certifications are offered twice a year in May and November. This one is offered on demand, online, at your computer, anytime you want to take it. So you just sign on. There's an online proctor. They'll have you pick up your computer to make sure you don't have notes and you're not cheating. And you can take it at any time. So we've had a huge success with this. We've gotten a lot of people coming into the field using this. It's a great way too, if you're hiring a new employee and you're not sure they meet that minimum knowledge competency, we have employers ask people to take and get this certification. So and it tests in these 6 areas. So I basically call it like kind of a watered down high level version of the CBET. So, medical devices. So we're not asking them to troubleshoot anything in this. We're talking about, can you recognize a picture of a defibrillator? Where would you use it in the hospital? Why is it there? Things like that. So it's very high level, but being able to know those types of things, MRI safety, obviously non-ferrous metals, things like that. Um, so that's what the CAB-T does. Um, so now we have our CBET and CRES. So I'm going to talk about these together because they're very similar. The only difference with the CRES is it's more focused in radiology. So when we go through the equipment piece, your questions are going to be much more focused in radiology. And you also have to have at least 3 years of experience working in radiology servicing, 3 years. So that's the difference. So when you get these, you're showing that, you are meeting a high credibility in the field. So the CBET is more for general biomeds. You kind of touch everything. The test, touches upon all different types of devices, where CRES is more focused in radiology. So this is how you qualify for the CBET or CRES. So you either need an associate's degree in biomedical equipment technology in 2 years of work experience, or if you don't have that, you can have 4 years of full-time work experience if you do not have a degree. And then there's other ways too. If you're from the military or if you have a related degree like in electronics, there's other pathways. And then, yeah, this is the same thing, but your experience has to be focused in radiology. And you don't have to have a title like radiology, BMET, or whatnot. You just have to be able to show on your resume, like even if your title is a general BMET or a BMET 1, 2, or 3, if you're still working on radiology equipment, that counts. When you apply, your manager signs off that you're being honest. So, if you list that you've done that work, even if your title doesn't reflect it, that's okay. And the same thing with the CHTM when we get to that. Even if you're functioning as a manager, even if you don't have a manager in your title, that's okay too. You just have to be able to prove that you have that experience. So here's the CBET and CRES outline: A&P, problem solving, safety in healthcare facilities, electronics, healthcare technology and function, and healthcare IT. It's 165 questions and you get 3 hours to take the exams. So again, healthcare technology and function, this is where you'll see the big difference in the CBET versus the CRES, because your CRES questions will be heavily radiology focused. And some of the A&P obviously as well. So the CHTM is so we're talking about the progression, right? You start with in the HTM field, you get your CAB-T, then you get your CBET, then you may move on to become a manager, director, and you're eligible for the CHTM, which is a Certified Healthcare Technology Manager. You do need 3 years of management experience to qualify for this. But again, you don't have to have the name manager in your title. If you're like a supervisory BMET and you're overseeing a lot of technicians, like that counts as well. So 3 years, like I said. You can also have gone through the DoD program, and there's different educational pathways. But if you don't have any type of degree, it's a minimum of 7 years in the field and 3 years of those being as a manager. And it's 100 questions and you get 2 hours, so it's a bit of a shorter exam. Financial management, risk management, operations, education, and human resources. I do also like to mention, I know we're obviously here in Connecticut and probably everyone's domestic, but we do get a lot of international folks taking our certifications. All of our tests do test to US codes and standards. So if you know someone even in Canada that's interested in testing, it is our gas coloring in the United States. We do not change it from country to country. So we do get, like, obviously in the human resource section here, we talk about ADA requirements, different kinds of human resource laws. It's all United States laws. So I just like to mention that. So now you've passed your test, you've gotten certified. So your certification lasts 3 years, and every 3 years you need to earn 30 continuing education units, or CEUs. So there are different ways to earn these CEUs, and we're going to talk about it. So if you get certified this window in November, you would be re-upped. So let's see, it's 2024. So 2025, 2026, 2027. December 31st of 2027, you would be due to renew your certification. We have a brand new way of uploading your journal for CEUs. I'm going to show a video in a minute. It is so much more user friendly. Our biggest recommendation, Maria and I would say, do it as you go. As you get your certificates, upload them on the website. Don't wait till the 30th of December Maria's phone rings frantically, like, I forgot to renew it. I didn't. So make sure you are doing it as you go. You get certificates. It's so much easier than trying to dig them all up the day before it's due. And if you miss the deadline, we do have a grace period, but then you get like a $50 fee, and no one wants to pay extra money, right? So if you do miss your deadline, you have till March 31st with a late fee. And we do randomly audit journals. So, we do trust that, you're doing this out of integrity, but we do select random people to audit. So just be aware of that as well. So here are your categories on how you can earn CEUs. So let's see. So added relevant certification. So this is the most important one, category 4, professional development. It's a minimum of 15 CEUs, which equals 15 hours. But you could do all 30 of those in that category. You also get 4 hours just for working, 4 CEUs just for working full time, 4.5. Yes. Yeah, that you're working full time. So if you work full time throughout the 3 years, you get 4.5. You can get an extra 1.5 if you're active duty reserve or in the military. So that's how you can get up to 6. But most people, it's 4.5. So if you subtract that, then it's 25.5 hours of learning. I do want to mention, a lot of people, the biggest complaint we get is that, there's no travel budget. Obviously, the economy is tough. Travel is cut, training is cut. If you are an AAMI member, we do free webinars every month, and those are all available on demand and free to our members. So if you watch all our webinars, you can get all the CEUs you need for free, and you never have to leave your house. So worst comes to worst, you can watch 30 webinars. I know TechNation and MD Expo do free webinars as well. There's a lot of free education. Just watch them, get your certificates, and upload them all. And then you can also get, if you're also working on another degree, if you're a leadership role, like let's say you're the president of NESCI, you can get CEUs for that. If you hold another certification that's relevant, let's say you have your CHTM and your CBET, you get CEUs for that. So there's all different ways to do it. But the most common pathway is really just doing the professional development. And that includes lunch and learns. You have a vendor come in and you're learning about telemetry units, sign in, get the sheet, that's proof. You just need to have proof that you were there. Being here counts for CEUs. So it's really not as hard as people think, and you really can do it for free too. So are there any questions about that before I move on? Because I think that's the biggest questions that we get is the renewal. Do you have anything to add, Maria? Anything that you see, like common questions or anything? Perfect. All right. So yep. So 1 hour of education is 1 CEU. So this presentation gets you 1 hour, and then whatever else you go to. Yeah. So did you scan your There's a QR thing that you're supposed to scan when you come in, or there's that QR code, and then they will mail you a certificate as proof that you're here. And if you attend all the classes at MD, you will get 8 CEUs that were approved by ACI. Yeah, so anything that's learning. So obviously, like walking the vendor floor, a happy hour wouldn't count as CEUs, right? But anything that you're actually like learning, and you'd be surprised though. People are like, oh, I spent an hour at the happy hour, and they're like, so it's like the things we get. But yeah, so anything that's educational, even like the AAMI exchange, we approve it, I think up to 17 CEUs. in good faith that you sat through 17 hours of training while you were there, and then you can download the certificate from our site and stuff. So most places like conferences will provide proof of attendance like that, but if you ever do go to something and don't get one, I would definitely ask, because the one thing we can't accept is registration. So like if you registered for MD Expo, that putting that in your CEU journal doesn't count, because we don't have proof you actually came. Like you could register and not come. So we need proof you were here. Does that make sense? Perfect. All right, I'm gonna roll a video. It's 7 minutes. It talks about how to renew your certification. So let's do it. That's Marie.
Welcome. My name is Maria.
Why is it?
I am the manager of AAMI sessions here at the AAMI today. I am excited today.
Oh, just kidding. Sorry.
Hello and welcome. My name is Maria Carolina, and I am the manager of certifications here at the AAMI Certification Institute. Today, I am excited to introduce you to our new online continuing education unit CEU Journal platform. This innovative tool has been designed to streamline your experience in tracking and managing your CEUs, ensuring you stay up to date with your certification requirements. In this tutorial, we'll walk you through the key features of the platform, from logging in and navigating the dashboard to submitting and reviewing your CEU activities. Whether you are a seasoned professional or new to the AAMI community, this guide will help you make the most of our new system.
Today, we'll be learning how to access and navigate the new AAMI CEU online journal. To begin, please open a browser and visit www.aami.org. This will take you to the AAMI homepage. From the AAMI homepage, please make sure that you're logged in, clicking on Log In in the upper right-hand corner. If you've forgotten your username and password, please click on the Forgot Your Password link.
That's the biggest issue with people is password reset.
Set up
So
your new password. Once you're logged in, you want to navigate to your
some people only log in once every 3 years. So
icon in the upper right-hand corner. On your profile page, you'll notice that this is where you can update all of your personal information. Make sure that if you change your primary email address or mailing address,
and that's another point. So if you change jobs and change your, you need to update your email with us, or else you won't get alerted that your certification is due for renewal. So a lot of people lapse because they say that they don't know, but so make sure you update your information if you move or have a new email.
The rules around recertification have not changed. You still need to maintain your journal by earning at least 30 CEUs every 3-year reporting period. You'll see as well, the categories here have not changed. There are still 6 total categories for which you can earn CEUs towards your journal. All the rules still apply. In addition to needing 30 CEUs every 3 years, there are still minimums and maximums for each of our categories. For categories 1, 2, 3, and 5, there's a maximum capacity of CEUs of 15. For category 4, there's a minimum of 15 CEUs needed. And for category
That's the professional development, category 4, the professional development.
You'll see here that this example, Tiger Woods, he has 24 of his 30 CEUs.
Yeah, Tiger Woods has a CBET, so very fortunate to have him as a member.
His submit and pay button is not active. Once that number reaches 30, the submit and pay button will become active and allows him to submit his journal for review and complete his payment. You can see below that Tiger Woods has already completed at least 15 CEUs in category 4. Now, all he needs are 6 CEUs to meet the 30 CEU requirement. Since there is no maximum in category 4 professional development, let's go ahead and add some CEUs here that he can meet that 30 CEU requirement. To add a new entry, please click Add. From here, you'll be able to input all of the information about the training.
And this is all new this year. It's a brand new interface. It's much more user friendly. So you can go in and you can do it as you go and you can see where you're at.
You can see that the example we used here was HTM Live. Most of these webinars are only 1 hour in duration, which would equal 1 CEU. But in this case, we made it 4. Now you can see a brief summary in this category of CEUs that have been submitted. Now, if we go back to the journal page, we'll see that we have 28 of the 30 CEUs now submitted for the journal. Let's add a few more so we can meet 30. You'll see here that I've added a position under category 6, work experience. Based on the dates for this entry, it says that Tiger Woods has been employed since July 1st, 2015 through today.
Yeah.
Even though this is more than 3 years of employment, you can only claim at most 3 years of full-time employment during your 3-year reporting period. Those 3 years would equal 4.5 CEUs as displayed in the entry. Now that Tiger Woods now has 32 CEUs, which surpasses the 30 CEU requirement, his Submit and Pay button is active. To submit the CEU and make a payment, please click on the Submit and Pay button. From here, please review the shopping cart to make sure that the certifications that you're looking to renew are included and that they have the right price. You can see here that Tiger Woods is not an AAMI member. Because of that, the initial certification is going to be $150, and the additional certification will be $75.
Yes, if you have multiple certifications, it's not 100 each. You get a discount.
Once you've submitted your journal and the payment, you can check to see that your recertification date is updated immediately by going back to the AAMI homepage, www.aami.org, and navigating to the certification directory. Hover over certification and click certification directory. From here, you can search your name to see that your designations have been updated.
This is also how you check if someone is certified. So if you're interviewing someone and they say they have their CBET, you go on here in the directory, type in their name, and you can see if they're, because there's a lot of people out there that get their CBET but never renew and they're lapsed, but they'll still keep the CBET credential. And we try to follow up with those people as we find them, but there are a lot of people that will claim that they're certified that aren't.
If you have any
So,
questions at all,
and you can always reach out to us directly too if you have questions.
reporting period, please reach out to us at ACI@aami.org.
Thank you for watching this tutorial. I hope you now feel more confident navigating the new online CEU journal platform. If you have any questions, reach out to us at aci@aami.org. Remember, staying current with your CEUs is crucial for maintaining your certification and advancing in your career. Thank you and happy learning.
There we go. So there's a couple ways to prepare for training if you're thinking about becoming certified. We offer multiple training opportunities now. So our BMAT 101 course is the CAB-T prep. So this is great for folks, if someone brand new out of the field, it's really your introduction to being a BMAT. It goes through everything from safety, regulatory, medical devices, A&P, and electronics. So even if someone's not interested in getting their CAB-T, if you have someone completely green and you want to get them trained really quick with, like, if you don't have, this type of training at your hospital, this is something that you can use. We also work with hospitals in like the big ISOs to put this in their LMSs. So if you're at a big organization and you want this available to all your new staff, we can work with you to get that in your LMS training system. Do you have a question?
Are vendors eligible to become CBATs or CABT?
A CABT, there's no minimum requirement, so anyone can be a CBAT, a CAB-T, sorry. So, and vendors can be a CBAT too, as long as you have technical experience. And then we have 3 different options to study for the CBET. So it's really going to be dependent how you like to study. And there's obviously other options out there. If you go on Amazon, there's like third-party companies. Obviously, Amy can't recommend anything else because we haven't vetted those courses, so we can't tell you if they're good or not. We only know what's in our content, but I know there's other stuff out there. So obviously, you could study however you would like. We have a self-paced course. This is called CBET 2.0 that we just updated. It's really cool. I went through it. And it goes through everything you need to know for the CBET. You can see the electronics section here. There's like flashcards, different types of studying. There's 30 question quizzes at the ends of every unit, and then there's a full 165 tests at the end that you can take. It just goes through all the sections and the content outline, and that's at your own pace. So you can do it as you'd like. We have the live study course. This is really popular. Dave Scott and Darren Armstrong teach this through Amy. It's twice a week for, is it 3 weeks or 4 weeks? 4 weeks.
Which one? The CBET study
Yeah.
is 4 weeks.
Oh, it says right here, 4 weeks, sorry. 2
8
hour evening sessions on Tuesday, Thursdays for 4 weeks. And you have access to live instructors. They teach it live via PowerPoint. They answer your questions. You also have access to them after hours, so you can email them anytime. They'll get back to you if you're studying. And all of this is recorded, so if there's like a random Tuesday night you can't make the course, you can go back and watch it. And all of these courses you have access to for a year. So you have access to all of that. We know that people just don't study right before the testing window. So this is, if you like that person-to-person interaction, it's really cool. And they do a really good job. They know their stuff. So, and we also have the CBET Smart Practice. This is just a Q&A type of course. So you go through and just take questions, and you either get it right or wrong, and it gives you information about it. This is built on a platform called Amplifier. And what it does, it was created by folks at Harvard Medical School that looked at the hippocampus in the back of your head and how you retain memories. And what they found is that if you get a question wrong and you're told it's wrong and you get told the right answer immediately, you're still too focused that you got the answer wrong to retain that correct information. So this goes off that premise. So it not only asks you what the right answer is, but then it asks you how sure are you? And based upon that, it does like this calculation and it reveals information to you as you go. And it's supposed to be more comprehensive for learning because of using that scientific data. So that's what this platform's built off of. It's really unique and really cool. But again, there's 3 different options for the CBET, whichever one you prefer to learn. And then we have the CHTM live study course, which is just like the CBET, except it's CHTM. Live instructors, if you know Angie Bennett and Jeff Louise, they are our instructors. They teach the course. It's 2 weeks long and 2 nights a week. So it's a little less time because the test is shorter and there's less information. But that's also really good too. You have access to them, ask them questions live, email them, and you have access to all the recordings. So these are our application dates. Like we said, we have a testing window coming up this November, and then it's always the 1st and 15th through the 15th of November and May. So if you decide that you want to become certified, you're going to fill out an application. We're gonna vet it, make sure that you are qualified. Once you're qualified, then you'll pay, right? And then you
The application, you need to complete an application and pay the fee at the time. We're gonna get an alert to review your application. If your application is approved, you will receive an email with instructions on how to schedule your appointment for exam at Criterion. Criterion is our vendor for the exam.
Yeah, so the Criterion is all the testing centers too. So you'll find a testing center near you and you'll schedule it anytime between the 1st and 15th of those months where there's an availability. But just be aware, Criterion does lots of testing like the SAT, so it's not just like only CBET. So like they only have, if they have 20 seats, they might not all be 20 CBET takers. It's once those seats fill up with any exam, so just make sure you schedule them early. And this came up as an issue last testing window before we had Maria when I was answering the phones. You do have to register at least 48 hours in advance. So some people like realize, oh shoot, tomorrow's the 15th and I never registered. Like you can't do that. So you have to like give the testing center at least 48 hours notice to register. Again, if you ever have an issue or something happens, reach out to us. You know, if you've registered for this November and can't take it, we can move you to May. And then if someone applies and they're not qualified and they paid, you just refund them.
There is $100 fee that we
Okay.
keep for the process, yeah, and we
Yes.
refund the rest.
Gotcha. All right. And then everything we talked about today is in our ACI handbook on our website. There's a QR code if you want to access it, but you can always go to AAMI.org/certification, and that's there. And it goes through all the outlines of the tests. It goes through all the qualifications. And people often reach out and ask, like, how should I study? Obviously, we have these formal courses. I'm not here to sell you anything. And I just to be blatantly honest, if you go through the ACI handbook, you're going to see the content outline of every exam, right? And then in there, you have your anatomy and physiology, and have all these like different areas. I would go through that content outline and see where you feel comfortable and where you don't. Study the areas that you don't. That's where I would start. And in the back, the last page of the ACI handbook are references. All the test questions come from those references. So even if you don't want to pay for a study course, you can go and read all those different reference documents and find the content. So there's many different ways to study and be successful. I took my CHTM. I felt from working in the field, it was very, I was well prepared just for my day-to-day work for the CHTM. The CBET obviously is harder because it goes back to the theory of electronics, anatomy, and physiology, things you may not have seen since college. So if I were to take that, I probably would have to go study a bit myself. But you know, so, but again, everyone's different. Oh. And you can always reach out to ACI@AAMI.org, or there's a phone number there. You know, you'll most likely get Maria on the phone, but we're always happy to help. We're really here for you. And again, please reach out anytime if you have questions, comments, concerns. Don't let things linger. If you're not sure if you're due for your renewal, just shoot us an email. We can help you out. So that's our presentation. Are there any questions about certification at AAMI? No, it's not.